that time of year, especially in Northern Virginia. Baseball season's right around the corner. So fields aren't open yet. A lot of teams are starting indoor practices, and that can only mean one thing, is that coaches are starting to throw hundreds of balls a day for batting practice. Now, these coaches probably went from doing nothing for the last 3 months since the season ended in October or November. They took some months off. Maybe they said, oh, I'm going to start training again after Thanksgiving, or I'm going to start throwing a little bit after Christmas. And then boom, all of a sudden the season begins and you go from nothing to throwing 200 balls from 30 feet away to hitters. So I think that coaches are often neglected when it comes to arm care and movement. And I actually had a couple of requests on social media from people who wanted a simple arm care routine for coaches. So I want to talk about what arm care is, kind of breaking it down a little bit, and then give some options that you can take or leave that you can try as a coach, because coaches are important. If they can't throw, then the team can't do much in certain cases, if you don't have a machine or anything like that. So what are my philosophies of arm care? The biggest thing with arm care is planning ahead of time. So the worst thing you can do, which a lot of people end up doing, is they go from 0 throws to 200 throws. You should obviously ramp up gradually. So maybe that means you plan practice where, okay, we're hitting off the tee early and I'm just throwing a few pitches to each of you and we're gonna gradually ramp up my arm. Maybe as a coach, you actually go throw with someone else to warm up for a few weeks ahead of time, something like that. Hopefully you've been training during the off season and doing things to keep your arm in shape, keep your body moving. That might not be the case, but hopefully you do that. Now, arm care itself can be a lot of different things. It can be light band exercises, it can be heavy squats, it can be everything in between. So what I want to talk about are 3 core tenets of arm care that I have. The first thing is looking at soft tissue mobility, so the mobility of the muscles themselves. The next is joint mobility, so the joints themselves, how are they moving? And the final thing is muscle activation. Muscle activation refers to the fact that if you're throwing or doing anything stressful, you're breaking down tissue. And so what happens then is your body sends inflammation and recovery and repair things into your body to make you feel better, but you got to get them moving. So if I just sit around all day and don't do anything, my arm gets very stiff, all that inflammation gets stuck there. So we want to activate those muscles, get them moving in certain ways that are stimulating, but not too irritating. So I want to show you some examples of soft tissue mobilization, joint mobilization, and muscle activation, some that I like specifically for arm care, and give you some ideas of what you can work on that are realistic for you if you're a busy baseball coach. The first area that I want to talk about is soft tissue mobilization, which is loosening up the muscles. So think about things like massage, lacrosse ball, foam rolling, massage gun, anything like that is loosening those muscles up, decreasing pain and increasing mobility. So the first few I want to take you through are using a lacrosse ball, which is something a lot of folks have or it's very easy to get. And then I'll show you a couple with a foam roller. Another thing I recommend a lot of folks have, easy to order, easy to have. So when we're talking about the lacrosse ball, the first muscles that I want to talk about are your wrist flexors, the muscles in your forearm here. Now those muscles are responsible for flexing your wrist and your fingers, which obviously we're doing, hundreds of times throwing a baseball. They also run across your elbow there and are important for guarding from elbow pain, your UCL, everything like that. So really simple if we're working on the wrist flexors, we're just putting a ball down here, going like this. With all of these, I want you to go for about 30 to 60 seconds. At least 30 seconds is good to get some effect. More than 60 seconds a lot of time can be counterproductive because you're just kind of beating the muscle up to an extent where it's going to be more sore from doing so. If you want to do more, I'd recommend doing it throughout the day for 60 seconds rather than like sitting here for 5 minutes and doing it all at once. So with all of these, you're going to roll around. If you find a spot that's tight, you can stay there. You can move around a little bit just to try to loosen it up. And then you keep rolling and find other spots. So very simple. With all of these, you want to be in a relaxed position where you can just let your muscle relax and just roll back and forth on there. So that's our first one. Another muscle I love using the lacrosse ball for are your triceps, so the muscles in the back of your arm here. Now the triceps are probably one of the most overlooked muscles when it comes to arm care. Now our triceps are important for extending our elbow, which we're doing with every throw. They also run in the back of your shoulder, so they're important for shoulder mobility. So what I love with a lacrosse ball for the triceps is just going here and rolling through there. And like I said, you can go all the way up to the top where they run into the back of the shoulder, just rolling through there and seeing where it's tight. If you find a tight spot, you can try to move the elbow back and forth, but making sure we're not skipping that muscle because that's an area where it might not bother you, but as soon as you put a lacrosse ball there, you go, oh, that's pretty sore, and that can be playing a major role. The next muscle I want to attack with the lacrosse ball are going to be your pecs. So your pec major and pec minor, they run from your sternum here all the way out into your shoulder here. So they're responsible for horizontal adduction. So when I start to throw, initiating the throw, they're compressing coming through here. So they can get very stiff, limiting shoulder movement, shoulder external rotation. So we want to just take the lacrosse ball, put it on a wall here, and kind of roll around, finding those tight spots. Now, you can roll from anywhere through here, up into here, into the arm itself, making sure we're not doing a ton of pressure on the ribs. If you feel what feels like muscle soreness, that's a good thing. If you feel more like a deep bone sensation, then you're probably on the ribs, so move somewhere else. We don't want to be pushing on the ribs too much here. We want to focus on the muscle belly itself. But trying to move through there and all the way up into there can be really helpful with working on that shoulder mobility to help you really get back into your throws when you're throwing. Next, I want to show 2 movements with the foam roller. So these movements can also be done with the lacrosse ball. The foam roller can be helpful though, because it's easier to roll it sometimes, and it's a bigger surface area. So it's not putting as much pressure in one point like the lacrosse ball is, but by all means, you can try the lacrosse ball for these. So the first thing I want to look at is the muscles of your spine, specifically your thoracic spine. You have muscles that run all the way up and down there, and our thoracic spine is helping us rotate when we're throwing. It's not a movement we do a ton during the day, so it can get very stiff, and those muscles can get very tight and limited to stop us from rotating, being able to extend, reach up overhead. So we definitely want to target those areas. So really simple, just taking the foam roller here, and I'm just laying like this, doing a little bit of a bridge. I like squeezing my shoulder blades around me here, so it exposes more of my thoracic spine and those muscles. Taking some deep breaths while I'm here, rolling all the way down, rolling all the way up, just trying to loosen up that area. Now, another great muscle to target that's very close to that is your lat, or your latissimus dorsi. So that runs from all the way down in your low back, all the way up into your shoulder. So when we pull down and through like that, that's using our lat. So you're gonna do a half turn so that you're down like this. You're gonna have your arm up over your head. This is gonna be kind of in your armpit area and a little bit down from there. And we're just gonna be rolling through there, finding tight spots along the way. Now, like we talked about with the pecs, I don't want you rolling a ton if you're feeling, rib pain or like a bruising sensation. You're probably in a bone. But if you're feeling tightness in the muscle, that's a great place to be. You can kind of play with the ankle a little bit of rolling forward, rolling back, but just kind of going through there. And between the two of those, you're really going to help get upright and get that shoulder up a little bit better when we're working on those. After we've mobilized the muscles in the surrounding areas, we want to talk about joint mobility. So by mobilizing the muscles, we are mobilizing the joints, because if the muscles aren't tugging on the joints so much, that's creating joint mobility. But we want to make sure we touch on some specific joint mobility stretches, movements, things like that that I really like that a lot of people miss. So the first one is going to be stretching out the shoulder. So a simple pendulum is a great exercise to do, where you're taking a reasonably heavy weight, something that you can hold comfortably, but it's still giving some force on you. Just anchoring on here, and we're just hanging here like this, just letting the shoulder hang down. We can try going back and forth with a little bit. We can just hang here, 30, 60 seconds, just feeling that shoulder stretch out a little bit, decompress traction through there. Now, if that's super easy, you can go over, hang on a pull-up bar, hang on a barbell, something like that, to give you a little bit more traction. Once again, if you're able to, relax into that and let that movement happen where we're actually stretching out through the shoulder there. Now, if we're looking at the elbow joint itself, what we want to avoid is having the elbow joint tighten where we're losing extension or full range of motion. So that can happen if you throw a lot. There can be micro trauma, especially in your bicep, and it shortens up and we start losing our ability to fully extend our elbow, which could put more stress through the elbow joint itself by doing that. So we want to make sure that we're taking a weight and coming. Something like this can be helpful to anchor you, and just working on bicep curls, going all the way down, feeling a stretch with that elbow, and then coming all the way up out of it. So making sure we're doing some curls, good for strengthening the biceps and the arm muscles in general, but also working on that mobility of going down to the bottom, letting it hang and stretch, and then coming up out of that. So making sure that we're targeting strengthening as well as elbow and shoulder health when we're doing those. When we're talking about joint mobility, it's important not to neglect the thoracic spine. So couple movements that I want to show you. The first one is going to be for rotation, just a simple open book. So we're laying on our side here, arms out like this, and then I'm reaching, following with my eyes, coming to this end position here. I'm keeping my knees together and my hips in place here. I'm just stretching through here. When I get to the end range, I'm going to take a deep breath in and out. And as I exhale, I'm going to try to stretch a little bit further, and then I'm going to come back to the starting position. I'm going to go back and forth about 10 times on each side with that. Now, if we're looking at thoracic extension, then we're going to use this bench here. and we're gonna do what we call a prayer stretch. So this is gonna work on thoracic extension as well as lat and pec mobility. So killing a lot of birds with one stone. So you're gonna be kneeling here. You're gonna have your hands here like you're gonna do a bicep curl. You're gonna bring your hands together like you're praying. You're gonna sink your butt down towards your heels, hands back over your head. What you're gonna think about when you're doing this is you're gonna think about bringing your chest down to the ground like you're extending through your thoracic spine here. You're gonna take deep breaths in and out. As you exhale, you're gonna try to push a little bit further into the stretch to further extend through your thoracic spine. So we're gonna be here, sinking down, deep breath in, out. And I'm stretching further into it. I should feel a stretch in my shoulders and my back. And I'm just gonna keep stretching through there, taking a few deep breaths, resetting, just trying that, feeling that extension through there, and then the stretch through the lats there. So those are a great way to mobilize your thoracic spine so it stays nice and loose. Make sure you get full rotation and full overhead range of motion when you're throwing. Next, I want to talk about muscle activation. This is the last component of arm care. So this refers to the fact that you want to gently stimulate your muscles to get the blood flowing, to get them moving, to get inflammation to go down, chemicals to come in and out, stuff like that. So I want to start with the wrist and the forearm muscles because these muscles can get very tight from throwing, yet we often neglect them when it comes to exercise. So taking a simple light weight here, we can do some wrist flexion where we're coming up like this, going full range of motion all the way through here. And we can do some wrist extensions, same thing, full range of motion all the way through here. I'm supporting my arm, so I don't have to worry about that. It's just my wrist and forearm that's doing all the work to come through there. When we're talking about activating the muscles of the wrist and forearm, it's easy to do flexion and extension, but a lot of times we forget supination and pronation, which is rotation through here, which we're doing all the time when we're throwing and can really tighten up those muscles in the elbow. So real simple, all you're gonna do is you can grab a stick. You can also have a dumbbell that you're holding to do this. I like having a stick because there's a little more feedback to it. And all we're gonna be doing is rotating as far as we can this way and as far as we can this way, keeping our elbow pinned to our side so we're not rotating through our shoulder here. And just going back and forth, feeling that stretch, feeling those muscles activate. If you wanna make it harder, you grab lower down on the stick, so you're having to do more of the stick when you're doing it. Longer lever makes it harder to do. So try that in conjunction with the other wrist exercises to really get the blood flowing in that forearm to get it to relax a little bit. The last muscles I want to talk about activating are the muscles of the shoulder. So 3 simple exercises that we can do that really fully. The last muscles I want to talk about activating are the muscles of the shoulder. So 3 exercises that fully help with the shoulder muscles, in my opinion, I want to show you real quick. So the first one is shoulder taps. So we're going to be down in a push-up position here, feet a little bit wider apart than normal. This is working on compression of the shoulder, and it's stabilizing all of those rotator cuff muscles to hold your shoulder in position because our shoulder is a really loose ball and socket. So those muscles work really hard to keep it in place. So if we go push-up position here, and we're just slowly tapping the opposite shoulder, hold for a second. Same thing on the other side, trying to work on the rest of your body, staying nice and straight. That's forcing all those shoulder muscles to stabilize you, causing a contraction, but not undue load. Now you can get crazy with those if you can be, coming through here and rotating or coming up like this. You can try different things, but just being in that push-up position, forcing compression and stabilization in your shoulder is hugely beneficial after throwing. Now, the next one is a pull apart. So this is working on the muscles of your back. So the muscles between your shoulder blades here. So your rhomboids, your scapula muscles, everything like that. We need to be here and we're just pulling back like this. It's a simple exercise, but it is very beneficial because we're working on that scapular mobility. So making sure our scapula come all the way forward and then squeezing all the way back, making sure we don't neglect those muscles back there that really help us when we're throwing of decelerating, slowing down from back here. It can get very tight in that area. The last thing I want to talk about is the triceps, which, as we discussed earlier, run all the way into the back of the shoulder. So a simple exercise is an overhead triceps extension. So we're here and we're just extending through there. So we're keeping this nice and straight, extending through there. So what we're doing with that is we're stretching the shoulder. We're also contracting and relaxing the triceps muscle to loosen it up and keeping us in that extended position. Now, I like to do it separately. So I would do one side for 10 and then the other for 10. If you're limited on time, you can grab one big weight and do that. You can try to use a band. I find the dumbbell the easiest, but it depends on the person. We just want to make sure we're going overhead and getting that full range of motion as best we can when we do those. So that summarizes all the muscle activation exercises that I like to give right away. So let's kind of debrief and summarize everything that we've talked about. Those are all my exercises that make up a simple arm care program. We talked about soft tissue mobility, joint mobility, and muscle activation. Those are 3 core components. Now you can pick and choose what you like. I don't expect everyone to do all these exercises every day after they throw, but taking some of them. If your forearms are always hurt, maybe we focus on the forearm exercise. If your shoulder is always tight, work on some mobility for the shoulder. Try all of them, see what you like, give them a shot. Of course, the best thing is going to be getting an individualized assessment. If you're in Sterling, Virginia, or in the local area, I'm happy to have you stop by Eclipse Wellness and take a look at you and give you an individualized plan. But overall, the biggest thing is to have a plan. So, beginning of the year, maybe we do more tee work, we do things off the machine, we have pitchers throw a little bit. There's no shame in that, because if you're the coach and you're limited and your arm's hurting and you're not able to focus on your job because you're worried about your arm, hey, every time I throw BP, my elbow hurts, maybe I'm not looking at the hitter, maybe I'm not looking and coaching as well because I'm so worried about my arm. That is a big issue. I see a lot of coaches who are very stubborn, who don't want to admit that they have issues, or they're too proud to admit they have issues. Throwing 200 pitches is a crazy thing to do. You never ask your pitcher to do it, but you probably do it a couple times a week and think nothing of it. So take care of yourself. It's going to help the team. It's going to help everyone be better, and it's going to make you feel better, which is the most important thing. We need to care about coaches. It's a long season. You know, you don't want to be that coach in March who all of a sudden your elbow starts hurting and it's like, what the heck am I going to do for the next 7 months? So above all else, have a plan, try these exercises, let me know if they're helpful. Thanks for watching.